Hey, what's up, guys? I want to welcome you back to my channel, and for those of you who this is your first time on my channel, I want to say welcome. Go ahead and hit that red subscribe button on the corner of the screen so you can subscribe to this channel. Hit that bell button so you can receive push notifications every time I upload a new video. With that said, and all that out the way, let's go ahead and get into this video. So, osteomyelitis. Why did I title this video Osteomyelitis? I titled this video Osteomyelitis, the way they explained it to me was I've been complaining about back pain for about 6 or 7 months, but I'm talking about severe back pains. Back pain so bad that if I laid down for 5 minutes, whether it was on my side, on my stomach, on my back, I would have such severe pains that I couldn't even get up. I would have to ask my partner to help me get up. And when he wasn't available, I would have to crawl up the wall so that I could stand up straight. And standing up straight was so painful. It just was unbelievably painful, right? It brought me to tears. So, I kept complaining. I went to the doctors regularly, about 3 or 4 different occasions, and I kept saying, I have this wicked back pain, like this back pain that just won't stop. And my arms are tingling, and I don't know why, what's going on. So the doctor would say, well, your arms are probably tingling because you slept on them. Lots of people do. And your back is hurting probably just because you're getting older, your body's changing, you're not exercising as much as you should. She would always disregard the pain or try to downplay the pain, right? So I got to go back to work because, the bills need to be paid and whatever. So I needed a medical clearance to do that. So I made a new doctor's appointment so that I could get this medical clearance. So anyway, she sends me for a back x-ray, and I don't go in until the next day, right? Because I just wasn't in a hurry, because I was like, well, what if it is that I'm getting old or whatever, So 2 hours later, maybe an hour and a half, an hour and 45 minutes later, I get a call from my doctor. And my doctor's telling me, you have to get to the hospital. Do you have a ride to get to the hospital? Do you have a car to get to the hospital? Can you call an ambulance so that they can transport you safely to the hospital? You need to get to the hospital. And I'm like, why? And she said, because they found bacteria in your spine and they have to investigate further. So I am a former IV drug user, or known as an IV drug user. They might treat me like I'm trying to drug seek or something like that, because I am in a lot of pain, and I have been for months, and you know that. And she promised me that they weren't going to treat me like that. She said she was going to call in ahead of time, and she said, if there's any problems, So I get to the hospital, I get admitted, I tell them exactly what they tell me when I go to triage and whatever, and they do their little thing, and then they take me back to the ER relatively quick, like within 5 minutes I was in the back of the ER, right? So then I am sitting on a gurney in this little ER suite, and then the ER doctor comes in, and I give her my story, and then she tells me, okay, well, you have to meet certain criteria for us to send you for an emergency MRI. If not, you're going to be sitting here for 6 to 7 hours for an MRI, because they're worried about insurance money. They're worried about getting paid, what they can do and can't do in the parameters of the insurance companies, right? So the next thing I know, the MRI is done. I'm going back to the emergency room. So I go down to the emergency room, and they're kicking. Okay. So then they wheel my ass out to the emergency room, and they put me next to this nurse's station. So it's loud. The EMT workers are walking by with their gurneys and new patients and all this crap, right? So the licensed practical nurse came around, and she was talking to certain patients, and I was one of those patients, and I gave her my story and why I was there and whatever, and she looked me up on this piece of paper that she was walking around with, and she was like, no, we're not waiting to do any spinal diagnostics or anything like that. We're just treating the pain. Let me talk to neurology and interventional radiology to make sure, but I'm positive that that's all we're doing. That's all they said. So I said, okay. So then she comes back this paper and she was like, no, we're just treating the pain. And I was like, oh, well, if you're just treating the pain, I'm going to sign myself out. You know, there's no reason why I need to be here. And plus, I've already missed a day of work. So I sign myself out and I go home. 3 hours later, I get a phone call. It's my doctor on the line. She's like, why did you sign yourself out of the hospital again? And so so I told her the story, and she's like, no, that's not true. Let me read you the radiologist report. So she reads me the radiologist report, and turns out they found bacteria like in my L5 and L4 and L2 and L3. It's just bacteria all over the place. I'm in my spine and around my spine. So I was like, shit, no wonder I'm in so much pain. She's like, you got to get back to the hospital. And I told her, look, I'm not going back to the hospital to sit on a gurney next to the nurse's station because that hurts me more. I'd rather go home and deal with it like that. So she's like, no, you can't do that. We have to keep you in the hospital so that they can see how they're going to treat it. Fine. So I go back to I said, well, the only way I'm going back to the hospital is if they have a bed ready for me upstairs. So she said, I'll work on the bed. As long as you promise me you'll go back to the hospital. I said, sure. So I get a phone call about 4 or 5 hours later. It's the hospital, admissions. They have a bed for me. So I was like, cool. Can I show up the next day in the morning? I asked them because I have to go down to the methadone clinic. I want to sign a release for them. I want to get a last dose letter, and I want to get dosed because I told her about the nightmare that happened when I was trying to get my methadone in the ER clinic. So she said, that's fine, whatever. So when I finally get a bed, I get the bed at like the geriatrics. It's the geriatrics floor, right? So I got a really cool bed. I got a bed with an air mattress that like goes like this. It like adjusts itself every couple of minutes so that you don't get bed sores. It was the most comfortable bed. It was like an oversized Craftmatic air mattress bed. It was just so cool. And so I'm loving it. I'm eating, I'm watching TV, and then the doctors come in. I tell them I'm in a mass amount of pain. They don't want to give me anything for the pain. They just give me these lidocaine patches that you can find at Dollar Tree. And I was like, what the fuck, you know? So then the nurse comes in and says they decided that they're going to treat you with antibiotics, this very strong antibiotics, because they can't go in and extract any fluid from your spine because where the bacteria is, they're in small spots and they might hit something and paralyze you. So they don't want to. Oh yeah. So then the doctors come back and they're like, what we could do is we could run a PICC line. For those of you who don't know what a PICC line is, a PICC line is basically like a semi-permanent IV that runs one end to your heart and the other end it runs, out like an IV. And you usually get a traveling nurse, a visiting nurse that comes to see you and puts the medicine in there for you every day. Wanted to send me away for 6 weeks to a rehab place and have this PICC line in me where they put this fluid in every day. And I was like, no, I'm not doing that. I've got bills to pay. I've got a life. I'm not going to do that. So then the second alternative was for me to do oral antibiotics and see if that works, which they told me is the most least effective way. And then another way I could do it is I could go every day down to the hospital, into their infusion department. They'll put a new IV in me every day, and they'll do it like that. And so I said, okay, that sounds like the best option, so that's what I'll do. It's just funny to me how when I got a bed and I was getting fed and I was liking the accommodations and, I was in my own little room and in my own little world and I was, making friends with the nurses and the patient care techs. The administration just wanted to get my ass out of there, but when I was in the emergency department and I was just sitting there on a little fucking gurney, they could care less how long I stayed down there, So, know what is going on with your body and know like the best course of action to take. So they told me that I definitely have osteomyelitis. And like I told you, that bacteria around my spine we can almost bet money that it came from my IV drug use. It could have been that I put a needle down and forgot to cap it, and then, you know, I capped it and washed it with, it could have been that it could have been that I forgot that I put a needle down on a surface that I thought was clean but wasn't clean, and it got bacteria on it. It could be that I rinsed the needle under tap water. It could have been that one of the cottons was dirty. It could have been from any of those things, you know. But one thing is for sure is I definitely got it because of drug use. And so I wanted to put that story out there because it's dangerous. It's dangerous as fuck. So yeah, so that's what happened. That's one of the reasons why I've been gone for so long, is because I've been in so much pain. I hope you enjoyed this story time. I am going every single day for infusion therapy. So they're running an IV in me every day for the next 42 days. So 42 times they're going to run a new IV in me and put this medication in, which is like a high dose of antibiotics, to see if this goes away. So I wanted everybody to be aware of what was going on, mainly because I wouldn't wish this on my worst enemy. And I just wanted you guys to know why I've been away for so long. And I just wanted to say what's up. And I hope that everyone is doing well. I hope that you guys had an awesome Christmas and having a happy New Year. I hope that you're staying clean and you're staying sober. And if you relapse, hey, tomorrow's a new day. You're not always guaranteed tomorrow. So, you know, you really have to think about it, and you should really think twice. And if you are in the clinic, on a clinic, and you find yourself still using, then you probably need to get more help. Because medicine doesn't make you not want to use. You know, for as much as they tell you, oh, this has that blocker and this blocker and that blocker, medicine is not the key and the end all be all to everything. You know, people are very complicated creatures. You know, we are not so black and white. So if you need to reach out to somebody and you have nobody, you can just leave a comment down below. And I want anybody who has something positive or good to say to sound off below in the comments. If you have any questions, I'll answer them. Just leave them down below. And so, osteomyelitis, that's what I was diagnosed with. That's one of the things that's going on. And so I just wanted to share that with you guys, because that could have paralyzed me. Okay, if I didn't know and I let it just continue on and on and on, or I would have just masked it with dope and other drugs, I would have never known that I had a bacteria in my spine that could cause me to go paralyzed. So I want you guys to pay attention to your bodies. And like I said, if you're still using, if you've relapsed, if you stopped using, but you find that something is not quite right, don't let them say to you, oh, it's just because you're a drug addict, or oh, it's just because you were a drug addict, or it's just because you're getting older. Don't let somebody downplay what's going on with you. And how you should act, and you know when you're not feeling or acting right. Unless you're high out of your mind, then you don't know. But Lance is making as much noise as possible. So I want to thank you guys for watching. Go ahead and don't forget to hit that red subscribe button on the side of the screen to subscribe to my channel, and don't forget to hit that bell button so you can receive push notifications every time I upload a new video. Thank you guys for watching. I love you guys. Until next time.